I'm Kate Czaplinski with the HAN Network, and we're talking today with Dr. Joshua Frank from Coastal Orthopedics. Doctor, welcome.
Thank you, and thank you for having me.
Now, we're talking today about shoulder injuries, and especially for high school athletes, shoulder dislocations must be relatively common, right?
Unfortunately, yes, it does vary based on sport, but with some of the more competitive sports, more contact sports, we're seeing it more and more.
And now, tell us, how does a shoulder dislocation happen in the first place?
Well, usually it's a contact injury. It's usually some kind of fall with the arm in a certain position that can cause it. There can be associated injuries that occur with the time of injury. It can be, relatively minor to major and incorporate some fractures too.
And once something like that happens, whether it's on the field, what do you suggest, the patient do immediately?
Well, usually a shoulder dislocation is a pretty significant injury. Fortunately, at most of the football games, there's trainers, there's doctors present. Some require a trip to the emergency room. After that, it gets to be a little more tricky depending on whether they need X-rays, MRIs, surgery, or whether they're able to get back with rehab and play that year again.
Right. I mean, how can you know if somebody's ready to get back on the field after something like that?
Well, tough question. Depends on the injury and how bad and the extent. Some do require surgery relatively soon. Others were able to get back with therapy and treat them throughout the season. Maybe they can avoid surgery altogether, or maybe we can hold off and do it at the end of the season.
Now, Dr. Frank, tell us about the kind of care that patients will receive at Coastal Orthopedics.
Sure. Well, fortunately, we have a new option of urgent care, open from 1 till 7 on most days and on Saturdays as well. So people can come in right away. We can get them X-rays, line them up. If they need an MRI, they can get evaluated by an orthopedic provider, and we can get people in without waiting, so we can hopefully get them back to sports as fast as possible.
That's right. And now, how can we prevent this from happening again in the future once you dislocate your shoulder?
Interesting question. Very, very high rate of recurrence, unfortunately. That's why some people do end up needing treatment. But we do whatever we can to try and minimize that chance and try and get people back as fast as possible.
And finally, Dr. Frank, what's the best way for people to get in touch with Coastal Orthopedics if they need your care?
Well, they have our website, which is coastalorthopedics.com, our phone number, which is 203-845-2200. And as mentioned, we can try and get people in pretty much immediately.
Well, Dr. Frank, thanks so much for coming out. This is an important topic, especially for high school athletes, so we really appreciate it.
Well, thank you so much for having me. I appreciate it.
All right, I'm Kate Czaplinski for the HAN Network. That's going to do it for this conversation with Dr. Joshua Frank from Coastal Orthopedics.